Welcome to NSG315 Study Session 13. We're talking about quality of life issues. Introduction. In general, quality of life is the perceived quality of an individual's daily life, that is, an assessment of their well-being or lack thereof. This includes all emotional, social, and physical aspects of the individual's life. In healthcare, health-related quality of life is an assessment of how the individual's well-being may be affected over time by a disease, disability, or disorder. In this study session, you'll be learning about the quality of life and quality of life issues for cancer patients especially. Learning outcome for study session 13. At the end of this study session, you'll be able to 1. Discuss quality of life, and 2. Explain the quality of life of cancer patients. Quality of life. Quality of life is a broad term that reflects a patient's overall sense of well-being and satisfaction with living. From the time of diagnosis, the quality of life of every person with cancer is affected in some way. They may be affected socially, psychologically, and physically, according to Ropka and Padilla, 2007. Physical needs. 1. Weight loss, change in taste, and decreased appetite. 2. Increased bowel movement resulting in diarrhea or constipation. 3. Odors and flators may arise from stomachs, fecal or urinary fistula. 4. Reduced sexual interest and sexual dysfunction. And lastly, 5. Erectile dysfunction and ejaculation dysfunction. Psychological needs. Anxiety and depression, body image and fertility. Social needs. Restriction from social activities. And lastly, information needs, family history. Hypothetical case study. Functional health pattern. Health perception, health management. Patient occasionally feels weak and fatigued. As regards to vomiting and constipation, she feels it as a result of constipation. She has been taken by Sarkodie. Bloody stool, she thought it was hemorrhoid. But as for severe abdominal pain, she does not understand. Nutrition metabolic pattern. The nurse identifies dietary habits of patients, which include low fiber intake, alcohol intake occasionally, high fat diet, and presently feels nauseated. Elimination pattern. Vomiting sometimes relieves feeling of constipation, constipated often, occasional diarrhea, and bloody stool. Activity exercise pattern. Able to carry out her activity of daily living and attend to her office activity until the morning of admission because of severe abdominal pain. Sleep rest pattern. Patient sleeps well at night until onset of nausea, vomiting, and severe abdominal pain. Under cognitive perception pattern, patient is able to express feeling of an abdominal pain, nausea, and has background knowledge about cancer. Self-perception, self-management. Patients don't feel less of herself before diagnosis. With diagnosis, now she's afraid. Role relationship pattern. She is effective at work as a principal, attends social function, enjoys her role as a mother and grandmother. Sexuality reproductive pattern. She is a widow, has 4 children and 2 grandchildren. Coping stress pattern. She enjoys time out with children and grandchildren. Value belief pattern. She's a Catholic, will love to be visited by priests. Religious beliefs does not interfere with treatment regimen. Quality of life for cancer patients. Quality of life for a cancer patient can be defined in so many ways. The quality of life can be significantly affected by pain, fatigue, and other symptoms of cancer and treatment side effects. Stress, family issues, and financial concern can also impact quality of life. Summary of study session 13. In this study session, you've learned the following. 1. Quality of life is a broad term that reflects a patient's overall sense of well-being and satisfaction with living. From the time of diagnosis, the quality of life of every person with cancer is affected in some way. They may be affected socially, psychologically, and physically. Number 2. Quality of life for a cancer patient can be defined in many ways. The quality of life can be significantly affected by pain, fatigue, and other symptoms of cancer and treatment side effects. Stress, family issues, and financial concern can also impact quality of life. Thank you. We've come to the end of this study session.